Hello, I'm Dr. Brian Evans, oral and maxillofacial surgeon from San Diego, California. I'm a fellow of the American Board of Oral and Maxillofacial Surgeons, a co-owner of San Diego Maxillofacial Surgery, a practice where we focus on facial rehabilitation, orthodontic surgeries, full joint replacements, nerve repair, and craniofacial syndromes. I'm also an associate partner at SD Oral, Facial, and Implant Surgery, where we focus on rehabilitation of some of the most complex dental deformities and implant needs, where we do all-on-X treatment, we do subperiosteals, as well as zygomatic and pterygoid implants. I initially trained in the United States Navy during a time of war, where we spent a lot of time with facial reconstruction. It was there I kind of found a passion for the rehabilitation of people's faces, as well as really taking care of the patient as a whole. In our practice, we focus on trauma rehabilitation, dental and dental alveolar rehabilitation, as well as full body health. So over the years and through my training experience, it has led me to be able to be a part of some really interesting educational panels, teach in the residency programs, lecture in symposiums, and most recently be an associate professor at the American Dental Institute. I've really enjoyed my time there because they are a fully capable educational center where we can do lectures, didactic and theory implementation, as well as hands-on training within clinical scenarios, and then the cadaver lab where we can really practice on the true anatomy of people's faces. It's not something that we can do everywhere, and I think that's what makes the difference with ADI education, is the ability to go, spend a couple of days, implement theory and then technique, and then be able to perform it in your practice the very next Monday. Due to the ADI capabilities, that's why I came up with this educational series, Sinus Lift to the Max. It's where we can not only share the techniques, the anatomy, the physiology, the biomechanics, and biocompatible type materials that we use, implement those in the sinus lift, and then get hands-on experience about how to lift the sinus, how to select cases, how to review imaging, so that your patients aren't always needing to be referred out. You, as a general dentist, can implement some of these skills so you can take on some of these cases in your own practice. During the course, not only will you get to listen to me lecture, it will be fun. You're also going to get some hands-on experience in the cadaver lab, so we can walk through step by step how to design your flap, how to access the sinus, how to protect the sinus membrane, and when that sinus membrane gets perforated, and it will, how we navigate those complications, and then also protect our patients against complications that they may run into after our procedure. Our hope is that this will be a full scope sinus experience for you, so you can really take on these cases and have confidence within your practice. My goal is simple. I want to be able to share enough information and give you enough experience over this weekend for you to start taking on some of the easier maxillary sinus cases, so you can start building your confidence, portfolio, and your ability to do some of these procedures in your clinic. Join me in November 20th and 21st as I go through this course, hopefully with you, and share this information. Hopefully you get registered, you get on the list, we'll enjoy a dinner, some great education, and we can enjoy some time in sunny Florida. I'll see you there at the Max.